As COVID-19 continues to rapidly spread around the United States, one system that has become greatly affected is the healthcare system. In this system, workers are now becoming concerned due to the lack of supplies that they're being provided. This includes masks, gloves, and other preventive measures to ensure their safety. Hospitals are also struggling financially as they're having to use up so many resources so quickly and are now postponing any non-life-threatening procedures to reduce the blow. Another part of the healthcare system that is being affected is nursing homes and independent living. This is due to the fact that elderly are at a much higher risk of the disease becoming fatal. And this means that they're having to put extra precautions to prevent the spread, including not allowing visitors, closing down recreations, and discouraging residents from leaving the property for any reason. Governor Beshear recently sent out an update stating that starting April 24th, Kentucky has partnered up with Kroger to introduce drive-through COVID testing. This will make testing available to all healthcare workers, first responders, and any symptomatic patients that are over the age of 18. The idea of drive-through testing is to minimize the amount of contact between patient and staff who are performing the tests. Other businesses around Kentucky are also beginning to partner up to make this more accessible, such as Walgreens and Rite Aid.
As the coronavirus continues to spread, healthcare professionals have concerns about how the virus could heavily impact women. Currently, women in the United States hold 76% of the healthcare jobs, according to the U.S. Census Bureau. In nursing, where women are the front lines of patient interactions, women make up 85% of the workforce. Nurses are scared that they might get exposed to the virus unknowingly and accidentally give it to their family members and/or other patients within the hospitals where they work. Doctors and other healthcare professionals who work at multiple hospitals are struggling to keep track of what they're allowed to do where. The situation is becoming really confusing because of how rapidly the virus is evolving. But some medical workers believe hospitals are erring too far on the side of business as normal and not taking the necessary steps to provide for the influx of COVID-19 cases. Medical workers fear that the U.S. will run out of hospital beds unless they stop doing elective surgeries, such as plastic surgery procedures and so on.
Due to the lack of personal protective equipment, hospitals are now turning to the public for donations of PPE that they may have in their homes or businesses. People are even starting to make homemade face masks to donate to medical workers or even for personal use. The CDC is now advising the general public to begin wearing face masks when coming out of quarantine. There is new evidence that shows that not only is the coronavirus droplet spread, but can also be spread through talking or breathing on someone. For this reason, the CDC is putting out new advisories about wearing personal protective equipment on an everyday basis when leaving the house. But Americans are being encouraged to make their own masks and not take up any of the much-needed medical-grade PPE that is needed by healthcare workers on the front line.
Returning from international travel? As of now, this is the CDC's advice on returning to the U.S. after international travel. Stay home for 14 days from the time you returned home from international travel. During this 14-day period, take these steps to monitor your health and practice social distancing. Take your temperature with a thermometer 2 times a day to monitor for fever. Also watch for cough or trouble breathing. Stay home and avoid contact with others. Do not go to work or school. Do not take public transportation, taxis, or ride shares. Keep your distance from others, about 6 feet or 2 meters. What to do if you get sick? If you get sick with fever or cough in the 14 days after you return from travel, stay home, avoid contact with others. You might have COVID-19, and most people are able to recover at home with medical care. If you have trouble breathing or are worried about your symptoms, call or text a healthcare provider. Tell them about your recent travel and your symptoms. Call ahead before you go to a doctor's office or an emergency room. If you need to seek essential medical care for any other reasons, such as dialysis, call ahead to your doctor and tell them about your recent travel.
Travel in the United States. The CDC, Center for Disease Control and Prevention, has been putting in place specific guidelines and recommendations for domestic travel due to the COVID-19 outbreak. This data is from late March, when the CDC started to put in place recommendations on travel. They issued a domestic travel advisory for New York, New Jersey, and Connecticut. They urged residents to refrain from non-essential domestic travel for 14 days, effective immediately. At this point, they had not yet set restrictions for all travel in the United States, but they did strongly advise U.S. citizens to refrain from all non-essential travel. They advised people to stay away from highly populated areas, like airports and beaches. The CDC also came up with a list of things to consider before traveling. Is COVID-19 spreading in the area that you are going? Will you and your travel companions be close in contact with others during the trip? Do you live with someone who is older or has a serious chronic medical condition? Is COVID-19 spreading where I live or where I will return home from when I'm traveling? All this information was found on the CDC website under the Coronavirus Disease 2019 tab under Travel in the United States. I also looked up the effect that COVID-19 had on spring break trips and beaches closing in Florida. I found that local officials had taken it upon themselves to close beaches. Popular towns like Fort Lauderdale and Miami issued orders to close their beaches. Shortly after that, many smaller beach towns did the same. College students and younger people in general had been criticized for not taking the virus seriously and disregarding that they could spread it to a high-risk population. It was reported that Governor of Florida, Ron DeSantis, was criticized for not closing the beaches early. Before deciding to permanently close the beaches, the governor recommended limiting 10 people per group while on the beach. It included 2 photos. The first photo showing that many spring breakers were still on the beach and that they were exceeding the 10-person per group guidelines set by the Florida governor. The photo shows the breaking news that 19 new corona cases in Florida were found and that there was 155 total. This showing that congregating in large groups causes the virus to spread more quickly. The second photo I included is South Beach, Miami on March 16th, 2020. The photo shows that law enforcement put up barriers to keep people from congregating on the beach. They also put strict laws in place that fine people if they were to go on the beach. Over a month later, many beaches are still closed and still have restrictions on them, but some beaches are thinking about reopening soon.
The coronavirus has had a serious effect on present politics, but also the future politics of the country. President Trump appointed Vice President Mike Pence to be in charge of responding to the virus on behalf of the country. He has gained 24% more popularity and is beginning to have a larger fan base. This could help President Trump in the fall with re-elections. Some Americans are critical of Trump, which is causing him to lose some support. 41% of our population think that he's not taking this virus seriously enough. But 65% of the Republicans think the virus is being exaggerated for political reasons by both parties in order to try and get reelected or elected in the fall. People are debating about a possible vaccine because there is no guarantees that it would be affordable for everybody. Different political parties are trying to figure out how they would approach it and what they would support to make it accessible and get themselves the best votes and support. 10% of Americans are concerned if the epidemic keeps up, in-person voting will be affected in the November election. If this virus is rampant again and we are all on lockdown, then there will have to be a new solution for the traditional in-person voting for the upcoming presidential election.
When looking at public schools in Kentucky versus another state, Virginia, they were about a month behind when it came to closing their doors officially for the rest of the school year. On March 16th, Virginia schools, public schools, closed for 2 weeks. They then made the decision, March 23rd, that all public schools would officially be closed for the rest of the year, and this applied for any colleges that were not already closed and had sent students home. On March 30th, teachers were allowed in Chesapeake, one of the cities in Virginia, to visit their classrooms for 1 day, but under any other condition, teachers are not allowed out into the schools to get any sort of material that they might need, or textbooks, class information, things like that. Until April 20th, teachers were not allowed to send out new material. Students had only access to the work distributed by the city, and they could not hold official classes over Zoom conferences until April 20th. That was also the first week allowing teachers to give students new materials, many of which held off on to not overwhelm students, but they were allowed to begin holding video conferences and check-ins with their students and seeing who needs paper copies and who has access to a computer or a Chromebook. Many high schools began giving out Chromebooks to seniors, and then it slowly would trickle down depending on the city's ability to pay for the Chromebooks, but mostly Chromebooks only reached high schools, and in some cases 7th and 6th graders, and 8th grade kind of applies into the high school. If elementary students were not already a one-to-one district, which Virginia Beach is, but many other cities in Virginia are not one-to-one, Chesapeake being one of them. They were in the slow process to transfer over, such as many Kentucky schools in different cities or counties are making that slow transform to using one-to-one learning. If they did not have access to a laptop at all, they would receive packets of state-issued classwork, and are going to be able to pick up or get dropped off packets for the continuing semester or school year.
Due to the increased number of coronavirus cases in the U.S., in early March, a lot of states began to enact that non-essential businesses such as hair salons, gyms, retail clothing stores, etc. close in order to try and reduce the spread. Due to this, nearly 10 million Americans had to file for unemployment, as nearly 5 million of those Americans worked in non-essential businesses. As some workers live paycheck to paycheck, it's become financially harder for some of them to make ends meet, as some are not able to work from home. So in early April, President Trump passed a stimulus bill that gave $1,200 to American workers who filed their taxes in the past year. This would give those unemployed a boost in income, but would also help stimulate the economy. While most American workers are unemployed, some businesses are still hiring in order to deal with the new demands. Places like Amazon, grocery stores, and online delivery services are hiring in order to accommodate for the rapid increase in people's online shopping sales due to the stay-at-home orders. However, some non-essential workers are still needed, as some retail stores and restaurants are doing things like curbside pickup. People can order merchandise and food online and pick it up without having to leave their car. This way, they are able to receive the items that they need while also maintaining distance and safety of everyone around them. This will also help keep businesses up and running and also help stimulate the economy.